So a little bit about my background and really why I started at Hinge Health. As was mentioned earlier, I worked in a variety of settings prior to joining Hinge Health. And one of the things that I noticed right away was that there were a lot of patients that would get better from traditional musculoskeletal care and physical therapy, but there were also a lot of patients that didn't get better. And I really followed the science on chronic pain, some of the updates on what we call a biopsychosocial approach to managing pain. And it made me passionate about trying to change how we provide care to patients in a way that makes conservative management more successful and accessible. And what I will be doing today is to tell you a little bit about how our program does that and how you should be looking at other programs to help with managing those costs as well. So I am really happy to be here also with Nick Simpson, HR manager for ATI. Nick, can you say a little bit about your role and what you do?
Yeah, absolutely. So the intro was really good. I have a background in casualty claims, workers' compensation, and spent a lot of time working with people that had workplace injuries, occupational diseases, and illnesses as well. So a lot of background working with people with orthopedic situations, MSK. I went ahead and left the administrator side to go ahead and join the employer side. Wanted to have the ability to influence what employers were doing to prevent injuries from happening in the first place, as opposed to just kind of putting the pieces back together after people had those injuries. So I ended up at ATI in 2017, started with workers' compensation, took on leave of absence, disability, other benefit programs, and that kind of led us to where I am. So excited to talk about Hinge Health today.
Thank you so much for joining us, Nick. So let's talk a little bit about what we're going to go through today. So first, we're going to just talk a little bit about the impact of MSK spend and what are some of the reasons why it's gotten so out of control. After that, we'll talk about how to evaluate a digital solution for musculoskeletal. And then we're going to dive in and have Nick give us a few best practices on how he selected a musculoskeletal solution. So let's dive in now. Let me tell you just a little bit of an overview about Hinge Health. We are a digital platform. We provide, we like to say, care for everybody and every body part. So we have a full clinical care team that includes physical therapists, health coaches, as well as physicians. And we can treat somebody whether they've had a new injury to chronic pain that they've been struggling with for years. We also have a women's pelvic health program and a surgical program as well. And we even have physicians who can do expert medical opinion if somebody's considering surgery. So let's dig into talking about the musculoskeletal claims and costs. So consistently, when we talk to employers, what we hear is that musculoskeletal almost always is one of the top 3 cost drivers. One of the things that we've started to hear recently is that we're also hearing that often there tends to be kind of a horse race between cancer and musculoskeletal claims. So recently, with some of the new biologics coming out, cancer care is becoming one of those top cost drivers. And so it's easy to think, oh, I should focus on that and not focus on musculoskeletal claims. But the difference is that really, if you're thinking about low-hanging fruit and thinking about a cost that you can impact, musculoskeletal is going to far be an easier claim to impact than cancer care. So if you just look at somebody who's recently been diagnosed with cancer versus somebody who has knee osteoarthritis and is considering a total knee replacement, the way that we would want to manage those patients is the same. We would want to provide current evidence-based best practice care for both of those individuals. But the difference is that with cancer care, the best practice care is often the most expensive, and we don't want to delay that care. But with knee osteoarthritis, we actually want to start with the most conservative treatment to manage that individual's pain. So with exercise, with some non-invasive ways of managing their pain as well. And so that's why thinking about managing MSK claims is really more manageable than cancer. And there's a huge cost there when we're thinking about the toll of musculoskeletal care. So we know that just the cost of musculoskeletal care, when you think about lost productivity, when you think about the costs of the claims, is really enormous. I'm not going to read those slides, but you can read it. And so really, if you think about how enormous these claims are and how much we can really eat away at these claims is why we really think that you should still be prioritizing musculoskeletal conditions in terms of claims that you can work on reducing the costs of. The costs for surgeries continue to raise. So this is looking at the difference between the cost of a total knee replacement in 2016 and 2020, and then the difference in the cost of a spinal fusion in 2016 and 2020 as well. And so continually those costs are increasing. The care is not substantially changing, right? There's not really revolutionary brand new technology on a new knee implant or a new material to make a spinal fusion. It's just that they're getting more expensive. And so really thinking about how we can manage these individuals in a conservative way is important. And what do we mean by that? How do we reduce the number of people who are going to surgery? So first we need to look at why people aren't successful with traditional conservative care. And that will lead me into actually why a digital solution can be really successful. So we want to think about the barriers to care that are sort of that traditional conservative approach. So if you think about going to a PT clinic that you've gone to in the past, maybe, if not, that's great that you've stayed healthy. Think about when a PT has given you a piece of paper with a picture of exercises and expected you to go home and then come back in 2 weeks and tell you how much they did or how well they did it. I was guilty of that. I was that PT for 8 years before I joined Hinge Health. And so thinking about how we can help with those conditions digitally is really important. So the first thing that a digital program will do is it'll make it more accessible. Somebody doesn't have to travel to their PT appointment. They don't have to pay a co-payment. It also makes it more engaging. They have exercises that they can follow on the screen. They're able to interact with their care team on a much more regular basis than when they were interacting with their care team or their physical therapist in person. So thinking about how to evaluate a digital solution is important. So first, can that digital solution address some of those barriers to care that I was mentioning? So do they make it accessible? Is a member able to do that anywhere at any time? Can the member actually choose how they're getting that care? What I mean by that is we know that there are actually a lot of our members who sign up for our program and choose not to see a physical therapist for a video visit and just choose to independently go through the program. Requiring somebody to do a PT video visit when they're safe to continue with these exercises independently is oftentimes not successful if that's sort of what you're making or forcing that person to do. So thinking about how you're going to reduce those unnecessary surgeries, does that solution have a way of educating members who are considering surgery? Also thinking about changing the experience for somebody who is at a higher risk of incurring more MSK claims and more MSK costs. So we know that when it comes to MSK claims and cost, about 5% of members drive 85% of the claims. So it's really important to use various pieces of data to try to identify those members early and then provide different means that we can use to address those conditions. And whether that is an expert medical opinion program, whether that is some technology or something that they can use to manage their pain instead of thinking that they need to go for that injection or that surgery or reach for that medication, really thinking about utilizing pieces of data, utilizing a comprehensive suite of technology and care team to make this conservative care more accessible, more successful. Let's now talk about how to think about the ROI claim. I'm sure that you hear lots of ROI claims. If somebody's ROI claim is too good to be true, that probably is the case. And so we need to think about how to evaluate the claims that vendors are purporting in terms of ROI. So thinking about things like, how long, how many studies have they done? Has the study been evaluated by a second party? How long was the time that they studied? How many subjects? So we published a study about a year ago. We worked with a global actuarial firm, and this included 136 employers over 2 years, which was over 8,000 participants that we looked at in a matched comparison group. We saw across the board reduction in all MSK claims. Surgery was the biggest one, unsurprisingly, and it was about a 2.4 to 1 ROI. And so really, this is what a study that demonstrates ROI should look like. And if the ROI is like 9 to 1, then probably you need to take a little bit of a closer look. So, Nick, I'm tired of talking. So what I'd like for you to do right now is just tell us a little bit about, actually, here's something I learned last night. Nick, when was it after you left undergrad?
Yes.
Nick actually was almost going to become a physical therapist. And so can you tell a little bit about that story and then how you ended up in your role now?
Yeah, absolutely. So when I finished school, I went ahead and was thinking about what's next, right? And was signed up and I was on a career path to go to PT school and went ahead and did an internship and showed up and spent some time there and worked with a number of different patients. And a couple names and faces pop into my mind as I'm telling the story. Yeah, absolutely. And I realized that I absolutely hated it, right? I hated it because I would talk to people and I would say, this is what you need to do, right? I'd open the textbook behind the doors and this is the plan, this is what you need to do. They would come back in and they'd say, my pain's still a 9 out of 10, Nick, it's not helping. And I'd say, did you do your exercises? No, they didn't do their exercises. And I thought at that time, there's no way I can do a career for the rest of my life, telling people, giving them the solutions and answers and helping them, and they're not doing the effort to help themselves. So anyways, long story short, took a right turn, left turn, however you want to describe that, and ended up handling casualty claims and then eventually ATI after that.
Yeah, and I love that you ended up at ATI because you really wanted to be, I guess, for lack of a better analogy, but part of the solution, right?
Right.
Rather than just managing the problem, you wanted to help prevent some of those claims. Yeah, physical therapy, when I started physical therapy, nobody told me how tiring it would be to just listen to people tell me about their back pain for 40 hours a week. And I think that utilizing some of these digital solutions is actually a way that we can help to manage the crisis that we have, which is that a lot of PTs are actually leaving the profession. So that's one of the reasons why access is so poor. It's about a 6-week wait list to get in to see a PT. I live in San Francisco, and that's what the wait list is. So I actually keep a treatment table at my apartment for when my friends need physical therapy, and I will have them come over and I'll treat them before they are able to get in to see a real PT. True. I actually took my table to somebody's apartment this last weekend for that. So tell us a little bit, Nick, about your role and a little bit about your employer population and your work.
Yeah, so ATI is an aerospace and defense company. We make specialty alloys and components. So for those of you that flew in for this conference, you experienced our material, right? Our number one customers are Aero. So that's Boeing and that's Airbus, Pratt & Whitney. If you flew here, you were touching, ATI material. The world's MRI machines have metal from ATI. Things like implants in the body, joint replacements, heart stents, all that's coming from ATI. So we do a lot with different manufacturing processes that are very unique and very specialized. And we're really proud of, what we do and how we do that. What that means, though, is we generally have a high barrier to entry in this industry. So when people work at ATI, they have to be there a long time. It takes a long time to go ahead and get certified, and employees come there and they want to stay. Right? In the places where we do business, we are a high-paying employer. And so we have, long tenured employees. Our average employee is there about 12 years. And we also have a 48-year average for leave and disability claims. So, definitely have an aging workforce that have done, physical labor throughout their life, and that leaves a toll on the body over time.
Yeah, what are some other challenges that you have with the population? I think it's incredible that most people stay at your company for their whole career, right? I think that really demonstrates that you all really care about your employees too, right? One of the things that we actually have seen recently in a lot of the research that's come out around industrial medicine and around workplace injury prevention and management is that the relationship that an employee has with their employer, not just kind of formally, but actually the feeling that their employer is taking care of them, is highly correlated to a reduction in work comp claims. And so the more that somebody feels sort of a sense of animosity towards their employer, the more likely they are to have higher rates of workplace injuries and higher rates of work comp claims. So I think that's incredible that you really focus on that relationship. What are some other challenges that you experience with that workforce?
Yeah, so I mean, some of the other things that we face generally are our geographic locations, right? We're strategically located along interstates, railway routes, places where we can have access to water and electricity. So we're not in major hubs or major metropolitan areas where it's possible to get physical therapy quickly, right? And so that's one of the things that made this solution really attractive to us is the ability to go ahead and have a digital platform. We heard a lot of employees saying, I don't use my smartphone. They don't want, self-service type options. So we had a little bit of a concern as we were looking at options. What does that look like for us? Is this going to be successful? So that was another concern and challenge that we had, trying to figure out how to help people that had injuries, that were going through things in their life, that we're trying to help them kind of get over that next step and hurdle in their recovery.
That's really interesting. I think that there still are people out there who are a little skeptical of using a digital platform to manage physical therapy or MSK claims. I myself was included. I remember when I was a few years out of PT school, this was probably 6 or 7 years ago when we started seeing some of the research on telehealth for physical therapy. And I went, come on, the word physical is in the name. And also I got a fellowship in manual physical therapy. So how is that going to be effective? But the more that we looked at the research, the more that we saw that telehealth and virtual physical therapy can be as, if not more effective than in-person physical therapy. So what I'm hearing from you is that you guys had some of the same concerns. Will my workforce actually want to engage in that technology? Will it be easy for them to use? And this is something that we hear a lot, particularly in a more manufacturing or industrial workforce. So tell us a little bit about the process that you went through to ensure that this would be a good fit for your population.
Yeah, so great question. So we work with a consultant, and we've heard so much throughout the conference, one of our top spends was MSK. So we wanted to address that. And in 2021, we looked at different options and different people that could maybe help us get through that and drive those claims costs down, whether it was healthcare, leave, disability. We saw it kind of across the board. So what we went ahead and did is we started first by looking at we started with testimonials, right? So we looked at the different people in this space, looked at testimonials, spoke with other employers and said, what have you done? What have you looked at, right? And we went ahead and reached out to them, got some fantastic feedback. Then we decided to go ahead and move forward with a pilot hit with Hinge Health. We signed up one of our business units of about 1,500 people. Went ahead and spent a year with that particular population looking at, hey, how is this going? What does this look like? Are people going to benefit? Are they going to use this, right? That was kind of the big question that we had. And then beyond then, we went ahead and looked at the utilization data. Were people using this? Was it helpful? And were we getting positive feedback from that trial that we went through?
Yeah, I think that's great. So you took a lot of different steps, right? You looked at the options out there, you talked to a consultant, you recognized the MSK claims were, high driver for you. You looked at testimonials, you got references from other employers, and then you even did a pilot first before sort of implementing it to your entire population. And so that really shows, again, a high degree of carefulness when sort of implementing these solutions for your employee base. So tell us a little bit about how the implementation went when you opened it up for your whole employee base.
Yeah, so the implementation was really easy. We utilized CVS, and so we used their point solution management. So no contract issues. It was very simple to go ahead and set up. Communication plan was put in place. It was very easy to implement. Data feeds were set up. So of all the outsourcing that we've done and I've experienced at ATI, this is definitely one of the smoother, easier processes to go ahead and go through for sure.
That's great. I love hearing that. So let's talk a little bit about some of the outcomes that you've seen with your employee population. Yeah.
So one of the things that I think is really, speaks to me on this particular slide is the 86% reduction in surgery likelihood, right? So we see kind of a template or a path where someone comes forward and they say, I have a shoulder injury. My shoulder hurts. It's causing me a problem. Next thing you know, they have a visit with their PCP. They get a referral for physical therapy. Sometimes they get in quickly. Sometimes they have to wait. In the meantime, they go back to the PCP, get an MRI, consult with the surgeon, and boom, they're off to surgery before they've even tried those more conservative measures, right? And so it's been really phenomenal for us to see people sign up for Hinge Health, get going, have that conservative treatment, and then have really positive feedback for us about, hey, this is something that actually helped me. I didn't end up going down the path and having surgery, because as we know, surgery is not always the answer, right? It can be the right solution, but maybe not for everyone.
Yeah, so one of the questions that we'll ask members in our program is how likely they feel like they are to having surgery in the next 6 months, in the next year. And this is really a good predictor of whether or not somebody is going to have surgery. So if you think about somebody who is starting to have knee pain and their friend down the street just got a meniscus scope and they're doing great. And so really, taking it back and educating those individuals on some of the conservative treatments. And as I mentioned earlier, making those conservative treatments more accessible is huge. What I love to see on this slide is 81% reduction in depression. So when we onboard members, we'll have them fill out the GAD-7 for anxiety and the PHQ-8 for depression, and we monitor those and re-administer them about every 4 to 6 weeks while they're in the program. There is a high correlation between mental health, both depression and anxiety, and chronic pain. And so if you are depressed, you are more likely to have chronic pain. And if you have chronic pain, you are more likely to be depressed. There are even providers who will manage and treat chronic pain by writing somebody a prescription for antidepressants. So that's how closely correlated these conditions are. And so we're seeing a decrease in that. We're seeing people who are living better lives, who don't feel as isolated, who, are able to function at a higher level. So let's talk a little bit. We'll do one testimonial. Can you tell me a little bit about this person?
Yeah, absolutely. And, one of the things that I would say overall is for people in the benefit space, nobody wakes up in the morning and thinks I need to email my company benefit team and tell them how much I appreciate them, right? So we don't hear positive feedback about stuff, but if there's programs and there's things that people don't like, the benefits team absolutely hears about it. And one of the things that I thought was really impressive, from day one with Hinge Health is we received no negative feedback, right? So it was definitely, kind of started to speak volumes for how quality this program was. There were no concerns or issues voiced by employees. So this testimonial was great. This actually came to us from a spouse of an employee. And so one of the things that, really spoke to me was the ability of this particular person to go ahead and kind of resume a regular life, right? We care about our employees, and one of the things that we recognize is you don't leave home at home when you go to work, right? So if this employee has a spouse who, isn't able to go out for walks with the family or go out with the dog or play with the kids or the grandkids, that's going to wear on that employee, right? And this speaks to mental and emotional health as well. So, this particular testimonial really rings true that not only an employee, but the spouse of an employee took their time to go ahead and provide this feedback to us, recognize the program and the benefit for what it was, and send that appreciation and acknowledgement.
I love that. Thank you. All right, so we have about 3 or 4 minutes to take any questions. Anyone have questions?
Okay, so hi. So my question's a little twofold. With ATI's demographic, I'm curious how did the communications work with, a lot of them being on the front lines and not, maybe open to digital resource? Just curious how that went for you guys.
Yeah, that's a really good question. So we are on a 6-month track communication track. So every 6 months, we go ahead and kind of remind or nudge employees about the Hinge Health option. What that looks like is we go ahead and provide a feed. It provides email addresses for employees so they get that at their home. The other thing that they actually also receive is home mailers, right? So it's in their cell phone, it's in their email inbox at work, but it's also going to their mailbox at home so that the employee and their family members can go ahead and see that. And so we refresh that every 6 months. Also, as we have a benefit navigation page, we include Hinge Health there, and we kind of plug it out whenever we can. Hey, here's a reminder. One of the things that we're actually just starting is we're including a Hinge Health flyer with our initial packet that goes out for leave and disability, right? If someone's going out for a leave of absence or disability related to an MSK solution, they may be waiting for a physical therapist. Here's a flyer. Here's how you can get a hold of them. So kind of multifaceted, looking at a lot of different options to promote that where we can.